Hi Brittany, my name's Carissa. I'm going to be helping you today prepare for your wisdom teeth extraction. I can see here you're a healthy 16-year-old and you haven't had anything to eat or drink in the last 6 hours, so I'm sure you're probably really hangry, and that's the worst part. I know. It's no fun when you can't eat or drink anything. So that's why we're going to hook you up to the IV so that way you can stay hydrated, okay? So I'm gonna connect you to the monitors. Since this is your first surgery, I'm gonna walk you through everything, make sure that you feel comfortable, and know that we're gonna make this experience the best experience for you. So right now, Mom can stay in the room if you want her to. And then once we get started, she will leave, and then we'll make sure she comes back before you wake up so that way she's the first face you see. I know this is nerve-wracking for you, but we're gonna make sure that you're comfortable and that Mom is here for you through this, okay? So I'm gonna start connecting you to the monitors. I'm gonna talk you through it. There's going to be 3 little sticky pads. One's going to go on your right shoulder, left shoulder, and then lower left side. They're going to be a little cold when I put them on, but they'll warm up, I promise. Then what I'm going to do is I'm going to place this little blood pressure cuff on your arm. It's just going to give your arm a tight little hug, and then it's going to release. I just want to be able to check your blood pressure before we get started, and then throughout the procedure itself. Now you're going to hear some beeping. That's just your heart rate. And then I'm going to put a little clip and pulse ox on your finger. It's just going to help read your oxygen levels. Right now, while you're on room air, it's just going to be normal. And then when I put the little nasal cannula in your nose, it's going to go up to like 100. And you're going to feel a little tickle in your nose, and then it's going to be just a little tickle, and then once Dr. Tolman comes in, then I'm going to turn it up, and you're going to feel a little more tickle in your nose, okay? Then what I'm going to give you the squishy ball. It's just like a little stress ball. You can play with it in your hands until he comes in, and then put a little band around your arm. That's just going to help him start the IV. And what it's going to feel like is just going to be a tiny little pinch, and then he's going to connect the IV, and then in a matter of few moments you're going to feel yourself feel a little sleepy, and then it's going to feel like just a couple seconds that the surgery was, and then you'll wake up and you'll be all done. What we'll do is we'll make sure that you have an ice pack on your face, so that way it helps with the swelling, keeps compression down, and then we'll stick a little Jamba Juice gift card in your bag so that way you have that as like a reward for afterwards, okay? Once the procedure's done, if you want to keep your teeth, we can give those to you. Some people like to keep their teeth as a memory, I don't know. So if you want, you can. If not, it's not a big deal. We can get rid of those for you. Maybe you'll get some money from the Tooth Fairy. That'd be a little reward as well. Wink, wink. So, right now, Dr. Tolman's coming in, and like I said, it's just going to be a quick little poke, or pinch, okay? Do you have any questions? No, the needle doesn't stay in. What we'll do is, it's just a plastic little tube that goes in your arm. It's just going to be that quick pinch, and then it's going to be gone, okay? And then he's going to put the medicine in, and then you're just going to go to sleep. We're going to connect some clips to you so that way we can drape you in the towel so we don't get your cute little shirt all messy. And then we're also going to drape one over your head so you're going to look like a nun. But it's just so that way we can keep your hair out of the surgery side, okay? And then we'll get you out of here and get you comfortable, and you're gonna just want to sleep the rest of the day. So we just say cuddle up and get you some movies, watch some Netflix, and just relax the rest of the day, okay? Alright, so if you don't have any questions, Dr. Tolman's in and we'll get started. I'm just gonna have you relax, and then what we're gonna do is when he's gonna have you squeeze that ball. Once the IV goes in, I am gonna strap your arm so that way it doesn't pull the IV out, and I'm sure you don't want to do that again. So I'm just gonna strap that in. All right. And was that comfortable for you? All right. Well, now that you're going to sleep, we're going to take Mom up front, and then we will get started.